The truth about varicocele, the risk of infertility and effective solutions. Have you ever felt heaviness or mild pain in your scrotum without knowing why? Or have you ever accidentally noticed something unusual but thought, never mind, it's probably nothing? If you have ever had this thought, stop for a moment. Your body may be sending a warning signal about a condition that many men suffer from without even realizing it. And more seriously, it can directly affect your fertility. Varicocele, one of the leading causes of male infertility, is often overlooked because it does not have clear symptoms in its early stages. According to statistics, 15% of adult men suffer from this condition, but most only discover it when they experience fertility problems. The worrying part is that many people fail to recognize the early signs of the disease. One day, you walk into a clinic because of infertility concerns, and the doctor says, "Your sperm quality is poor, and the cause may be varicocele." At that moment, you start to worry, but it might already be too late. So what exactly is varicocele? How dangerous is it? And most importantly, can it be completely cured? Watch this video to learn how to detect it early and treat it properly, before it's too late. 1. What is varicocele, and how many stages does it have? Varicocele is a condition in which the veins in the scrotum become enlarged, preventing normal blood circulation. Imagine these veins as a plumbing system, when the flow is blocked or weak. Water stagnates, causing the pipes to expand. The same happens with testicular veins, where weakened venous valves cause blood to flow backward, leading to enlarged and twisted vein clusters. When the veins dilate, blood circulation is disrupted, causing the temperature in the testicles to rise. Did you know that if the testicular temperature increases by just 1 degree Celsius, it can significantly reduce sperm quality? This can result in weak sperm, a lower sperm count, and even infertility if not treated in time. How does varicocele affect the body? White heavy checkmark pain or discomfort in the scrotum, which often worsens when standing for long periods or engaging in strenuous activities. White heavy checkmark testicular shrinkage over time due to blood congestion, which reduces the necessary nutrient supply. White heavy checkmark reduced sperm count and quality, leading to difficulty conceiving or an infertility risk 4 to 5 times higher than normal men. White heavy checkmark in some cases. You may feel vein clusters under the scrotal skin, resembling a bag of worms. The disease may not cause clear symptoms in its early stages, leading many to ignore it. By the time it is discovered, it might already have progressed to a severe stage, seriously affecting reproductive health. Varicocele does not occur suddenly but develops gradually over time and is divided into several stages. Understanding these stages will help you determine which stage you are in and whether you need to see a doctor immediately. Stage 0, subclinical varicocele. At this stage, the veins are just starting to slightly dilate and cannot be detected by the naked eye or by touch. You will not experience any symptoms. And it can only be diagnosed through Doppler ultrasound, an imaging technique that helps assess blood flow in the veins. Right arrow symptoms, no clear symptoms. Only detected during a general health checkup or infertility evaluation. Stage 1, mild varicocele. At this stage, the veins begin to enlarge more. But they can only be detected using the Valsalva maneuver, standing straight, taking a deep breath, and gently straining while a doctor examines the area by touch. Right arrow symptoms. Not visible to the naked eye. Slight heaviness in the scrotum, but not too uncomfortable. Often discovered during a reproductive health examination. Stage 2, moderate varicocele. This is the stage where you may start noticing changes yourself. When standing upright, you can feel slightly swollen vein clusters under the skin, but when lying down, they may disappear. Right arrow symptoms. Increased heaviness in the scrotum when standing for long periods or engaging in physical activity. Occasional dull testicular pain, but it does not last long. Vein clusters can be felt when standing but disappear when lying down. Stage 3, severe varicocele. At this stage, the vein clusters become significantly enlarged and visibly bulging on the scrotal skin, resembling twisted cords or a bag of worms. Right arrow symptoms. More intense pain, especially after standing for a long time or strenuous exercise. Testicles may slightly shrink and lose firmness. You can feel the enlarged veins even without the Valsalva maneuver. Stage 4, critical varicocele. This is the most severe stage, where the veins are severely enlarged and always visible, regardless of body position. If not treated promptly, severe testicular shrinkage may occur, significantly affecting sperm production. Right arrow symptoms. Vein clusters are always visible, even when sitting or lying down. Continuous testicular pain, even without physical activity. Significant testicular shrinkage, with a noticeable size difference between the two testicles. Severely impaired fertility, with a high risk of infertility. 2. Symptoms and diagnosis of varicocele. Many patients with mild varicocele have no symptoms and no serious concerns as long as the condition does not progress to a severe stage. However, if the following symptoms appear, the disease has usually reached a point where it affects the testicles and sperm production function. Dull pain in the scrotum, due to anatomical structure. Most cases of varicocele occur on the left side of the scrotum or are more severe on the left than the right. This pain is typically dull, eases during sleep or rest, and worsens when standing for long periods or engaging in strenuous activities. Testicular shrinkage and atrophy. Varicocele significantly impacts blood circulation, causing blood to accumulate in the scrotum, leading to a slight increase in scrotal temperature. This temperature rise negatively affects testicular function, damages testicular cells, and may lead to testicular shrinkage and atrophy. If not treated early, testicular atrophy due to varicocele can result in infertility. Reduced reproductive function. Although there is no definitive scientific evidence proving a direct relationship between varicocele and male infertility, many infertile men are diagnosed with this condition. If you experience any of the above abnormalities, especially changes in testicular shape or size, scrotal swelling, infertility, or the appearance of twisted vein clusters in the scrotum, you should visit a hospital for an examination as soon as possible. Most patients undergo a physical examination, where doctors observe and palpate to detect abnormal blood vessels or lumps, to accurately diagnose the severity of varicocele and assess its impact on reproductive function. Patients should also undergo additional laboratory tests, such as white heavy checkmark semen analysis, white heavy checkmark ultrasound. 3. Effective treatment methods for varicocele. If varicocele does not cause symptoms, does not affect health or reproductive function, and is at a mild stage, doctors typically do not recommend treatment. However, regular monitoring is necessary to detect any progression and intervene when needed. Cases that require varicocele treatment. Heavy checkmark severe varicocele. Heavy checkmark varicocele associated with low sperm count or poor sperm quality. Heavy checkmark swelling, pain, or discomfort that affects daily life and activities. Medical, non-surgical, treatment is usually ineffective for varicocele, so doctors often consider one of the following two treatment methods. Method 1, venous embolization, minimally invasive. Quick recovery. This is a non-surgical procedure that temporarily blocks blood supply to the affected veins. The process involves local anesthesia, ensuring it is painless. The doctor makes a small incision in the groin to insert a catheter, guiding it to the dilated testicular veins and sealing them off. Afterward, blood no longer flows to the affected veins, preventing swelling, pain, and damage to surrounding organs. Advantages. White heavy checkmark no surgery required, only a minimally invasive vascular procedure. White heavy checkmark: less pain, minimal risk, and quick recovery time. White heavy checkmark: suitable for patients with mild to moderate varicocele. Disadvantages. Crossmark: less effective than surgery, with a success rate of approximately 80%. Crossmark: some patients may experience recurrence, requiring additional treatment. Method 2, surgical removal of dilated veins, highest success rate. In this procedure, patients undergo general anesthesia so that the affected veins can be surgically removed. This method has a higher success rate than embolization, reaching up to 95%. Patients may choose open surgery or laparoscopic surgery, with similar intervention techniques, but different levels of invasiveness and effectiveness. Advantages. White heavy checkmark: high success rate, 95%. Significantly improving sperm quality. White heavy checkmark: lower risk of recurrence when performed correctly. White heavy checkmark: best suited for severe varicocele cases that impact fertility. Disadvantages. Crossmark: longer recovery time compared to embolization. Crossmark must be performed by a skilled specialist to prevent complications. 4. Can fertility improve after treatment? The answer is yes. But it depends on the extent of testicular damage before treatment. Research has shown that heavy checkmark: 60 to 70% of men experience a significant improvement in sperm quality after surgery or treatment. Heavy checkmark: the natural conception rate increases by 40 to 50% after treatment. Heavy checkmark: if varicocele is detected and treated early, the chances of full recovery are very high. However, if the condition persists for too long, leading to testicular shrinkage or severe impairment of sperm production, the likelihood of recovery decreases. 5. Methods to prevent varicocele. Although varicocele can occur due to genetic factors or blood vessel structure, you can reduce the risk by adopting a healthy lifestyle and scientific habits. Below are methods to prevent varicocele and limit its progression. Maintain a stable weight, reduce pressure on blood vessels. High-voltage obesity and being overweight are among the leading causes of increased abdominal pressure, which affects testicular veins. When abdominal pressure increases, blood circulation is restricted, leading to blood pooling in the veins, which can result in varicocele. White heavy checkmark prevention tips. Heavy checkmark: maintain a healthy BMI. Avoid sudden weight gain. Heavy checkmark: eat a balanced diet, limit oily, fatty, and sugary foods. Heavy checkmark: exercise regularly to maintain a healthy body weight. Avoid sitting or standing for long periods, support blood circulation. Prolonged sitting or standing can cause blood stagnation in the pelvic and scrotal areas, directly affecting testicular veins. Office workers, drivers, and mechanics are at higher risk. White heavy checkmark prevention tips. Heavy checkmark: if your job requires prolonged sitting, stand up and stretch every 30 to 45 minutes. Heavy checkmark: if you must stand for long periods, frequently change positions to avoid excessive pressure on the scrotum. Heavy checkmark: use a small cushion under your seat to help improve blood circulation when sitting. Avoid wearing tight underwear, ensure proper blood flow. Wearing tight underwear can increase pressure on the scrotum, restrict blood flow, and increase the risk of varicocele. White heavy checkmark prevention tips. Heavy checkmark: choose breathable, elastic underwear made from cotton to support proper blood circulation. Heavy checkmark: avoid wearing tight underwear, especially during exercise or prolonged sitting. Heavy checkmark: if needed, use specialized men's underwear to support the scrotum without excessive pressure. Exercise properly, improve blood circulation. Exercise improves blood flow. But incorrect workout techniques or overexertion, especially exercises that increase abdominal pressure, can increase the risk of varicocele. White heavy checkmark prevention tips. Heavy checkmark: choose light exercises such as walking, swimming, and yoga to improve blood circulation. Heavy checkmark. Avoid lifting excessively heavy weights, as it can increase abdominal pressure, leading to varicocele. Heavy checkmark. Breathe properly during exercise and avoid straining too much when lifting weights or doing squats. Prevent constipation. Avoid increased abdominal pressure. Chronic constipation forces you to strain excessively during bowel movements, which increases pressure on the abdomen and scrotum, directly affecting testicular veins. White heavy checkmark. Prevention tips. Heavy checkmark. Eat fiber-rich foods like vegetables, fruits, and whole grains to improve digestion. Heavy checkmark. Drink enough water, 2 to 2.5 liters per day. Heavy checkmark. Avoid processed foods, fried foods, and spicy foods, which can cause constipation. Limit alcohol, beer and stimulants. Keep your veins healthy. Alcohol and smoking damage blood vessel walls, cause vein constriction, impair blood circulation, and increase the risk of varicocele. White heavy checkmark. Prevention tips. Heavy checkmark. Limit alcohol consumption, especially strong liquor and high alcohol content beer. Heavy checkmark. Avoid smoking, as nicotine can constrict blood vessels and affect circulation. Heavy checkmark. Drink water, fruit juice, or green tea instead of alcoholic beverages. Get regular health check. UPS, detect early and intervene in time. Early stage varicocele often has no clear symptoms, so regular men's health checkups help detect the condition early and prevent complications. White heavy checkmark. Prevention tips. Heavy checkmark. If you are between 18 to 40 years old, have a men's health checkup at least once a year. Heavy checkmark. If you experience scrotal pain or heaviness, visit a doctor immediately. Heavy checkmark. If you are planning to have children, check your sperm quality to ensure reproductive health. If you find this video useful, please like and share to help others understand varicocele better. Don't forget to subscribe to the channel for more helpful health updates.